Madam Speaker, I would like to yield time to Congressman Garamendi from California.
Thank you very much, Congresswoman. As you recall, you and I have had a long history of dealing with health care issues. In the late 70s, I was chairman of the California State Senate Health Committee, and when I left that post, you took it over. And over those many years that you and I have worked on health care, we are now approaching the final moment in which this nation will take up an extraordinarily important task. That is of moving towards providing health insurance and health care for all of the citizens in this country. It's going to be a very busy week next week. Over the last hour or so, I've heard from our esteemed colleagues on the Republican side talk about a rush to judgment. It was not a rush to judgment if you consider the 30 years that you and I have been spending trying to provide health care services for all the people in California, and now we have this opportunity to deal with this issue here on the national for the entire nation. It certainly wasn't a rush to judgment in the early part of the 20th century when in California and across the nation men and women were being injured on the job, and to deal with that the workers' compensation programs were created. Even Teddy Roosevelt back in those periods said that we needed to have a health care system for all. It didn't happen then. During the World War II period and before it, the Blue Cross Blue Shield programs were developed by the medical community to provide services, but again, it wasn't universal. It wasn't available to all. Later during World War II, I remember in California on the West Coast, Kaiser Industries found that their workers were getting sick. Actually, it was during the Depression when they were building the dam on the Colorado River. And so they started what has become known as Kaiser Permanente to provide health care to their workers beyond just the workers' compensation program. In the 60s, we made a major step forward here in America with Medicare and then following it with Medicaid. An enormous debate erupted, but progress was made, and a universal program was made available to every person, every legal person in this nation who attained the age of 65. And I noted with some humor the period that the President's Summit just about 10 days ago, in which sitting around the table were men and women, nearly all of whom, excluding the President and I think just two others, who actually belonged to a single-payer universal health care program called Medicare. And yet many of those people said that they wouldn't want anything to do with a single-payer universal health care system, but yet they were participating in such a system. So we have been at this a long time, and in this House, the debate on how to finish the process began 1 year ago. So there's no rush to judgment here, nor is there a rush to judgment.
Mr. Garamendi, will you yield for a moment?